Good afternoon, everyone, and welcome to the Granite Bay Seventh-day Adventist Church. The Granite Bay Health Ministry team would like to welcome each of you here to our Summer Health Revival Series. We're very excited to have with us a distinguished speaker. Our speaker for today is Dr. Joshua Arvizu. He will be focusing on an important topic that's not very often thought of when we think of chronic diseases and metabolic conditions. So Dr. Arvizu is a graduate of Montemorelos Medical School. He and his family have moved here to the area within the past several years, and we're very excited to have him join us today for this important information. So, Dr. Arvizu, I'll welcome you to the stage.
Thank you very much. It's a pleasure to be here with you. I hope you all enjoyed your lunch. I know I did. My lunch was great. Before I begin, I will like to start and open with a word of prayer, if you don't mind. Let's bow our heads. Dear Heavenly Father, we thank you for your love, your mercy, for this Sabbath day of rest. We thank you, dear Lord, because you've given us an incredible message of health, dear Lord, that goes right hand in hand with the third angel's message, the last message to this world, dear Lord. And I pray, dear Lord, that we can have receptive hearts, dear Lord. We all have struggles in our lives. We all have personal things we're struggling with in regards to our health. But in your name, dear Lord, you've promised victory. And we trust in your name, dear Lord, and I pray that you be with us as we open this, and we study this subject, dear Lord, and that you help us to be doers of your word. We ask this in the name of Jesus. Amen. Thank you, Roger. I appreciate the health ministry and their efforts in bringing health topics that will revive us. If you notice, the title of this summer's health series is Revival, or summer health series of Revival. And I know many of you know this famous quote from Sister White, and it says the following: "A revival of true godliness among us is the greatest and most urgent of all our needs. We must have the holy unction from God, the baptism of his Spirit. It is the Spirit of God that quickens the lifeless faculties of the soul to," and I underlined there the word that I want us to focus on, "to appreciate heavenly things and attract the affections toward God and the truth. There must be an earnest longing, a soul hunger for the presence of the Lord." So I believe that the Lord, as he gives us this three angels message to the world, a message of love because he doesn't want anyone to perish but to have everlasting life, he has linked it to the health message because he wants the world to understand the consequences that we are facing. He wants everyone to be saved. And before he lets go of the last plagues upon the world, he wants everyone to make a conscious decision. He wants us to appreciate the message. And to appreciate the message, he has given us the health reform. To appreciate the message, we also need to have a healthy liver. The liver is an incredible organ. Incredible organ. I'm sorry, are you guys able to see very well there? I just want everyone to see. There you go. Okay. The liver is an incredible organ. The Chinese actually say, they believe, that the soul resides in the liver. Very interesting. They believe that it is where awareness and consciousness resides. Another interesting fact, or amazing fact, if you could say, is that it is the largest glandular organ in our body. And it is the second largest organ after the skin. Very good. I heard the skin back there. The skin is the largest organ, and the liver is the second largest organ. It is about the size of a ball they use for rugby, about that size. It is on your right, what we call the right upper quadrant. So if you can just put your right hand right here below the rib cage, that's where it is. It's a very big organ, right? Pretty big, the size of a rugby ball. You know, that's considerable size. So it actually can cover most of the right upper quadrant area. And it has amazing abilities. God has made this organ with just incredible abilities. This organ is one of the few or only organs that can actually regenerate. So let's say that Roger here, for some reason, needs a liver transplant, right? He has fatty liver, it has progressed, and he has developed fibrosis. And all of a sudden, Roger goes to his gastroenterologist and he says, you know what, I have bad news for you, Roger. You need a transplant. And so Roger says, I need help here. I need a transplant. Who can donate a liver for me, or a part of a liver? And I say, Roger, I love you. You're my brother. I will donate half of my liver to you. Incredibly, that half part of my liver that I donate to Roger, in his body, if he takes care of that organ, if he takes care of that new liver, piece of a liver, half of a liver, that organ will regenerate into a full liver. Incredible, right? And the half that I have left over will also, if I take good care of it, if I follow the lifestyle guidelines, what's going to happen is I'm going to regenerate my liver, and I'm going to have a full liver again. So it was actually a sacrifice that paid me back, right? I have my liver back, right? So it is incredible what the liver actually does. Did you guys know that the liver is the place where you have the synthesis of blood when we were in our mother's womb? So we didn't have our bones well developed, and while we were in our womb, when we were in our fetal state, that's when the liver produced blood so that we can live. It is the project manager, as some people call it, of the human body. It carries out about 200 to 500 functions, which include the metabolism of our food, creating it into energy. We're going to talk a little bit more about this. It stores it as glycogen in the muscle, and basically a metabolism of glucose is stored as glycogen in the liver and in the muscles. Like I said, we'll talk a little bit more about this in just a few minutes. And it stocks vitamins and nutrients along with iron. The liver also protects the brain, not only by supplementing or giving it the glucose it needs to be able to function, but it also protects the brain by detoxifying many of the harmful substances that we intake so that the brain may be maintained in a healthy, optimal state. Have you guys seen, or have you guys noticed, or have you guys heard of any patient that has encephalopathy, as an example? Encephalopathy is a condition that happens when the liver is not working anymore, so it's not detoxifying our blood. And what happens is that all these toxins go to our brain, and you could become encephalopathic. Encephalopathic means that you start becoming more lethargic, you start having stupor, and confused, and you start shaking a lot, right? I don't know if you guys have ever seen any patient like this. But when our liver is not functioning well, our brain is affected. And consider what we're talking about, revival and our capacity to understand how it's affected by our liver. It also contains, and this is where we're heading, it contains fat. An appropriate amount of fat is about 5% of fat in the liver. Anything higher than this is considered what we call fatty liver. Fatty liver, or non-alcoholic fatty liver, NAFLD, is now termed, has a new terminology, and the new terminology is this that you see here on your left-hand side of the screen. It is metabolic dysfunction associated steatotic liver disease. Whew, I was able to say all that. But they have changed the name to this metabolic dysfunction associated steatotic liver disease, MASLD. I wonder why they changed it to metabolic dysfunction. I believe the name says it, right? You guys remember the term metabolic syndrome? And metabolic syndrome is a charade of conditions: high blood pressure, obesity, high sugar levels. The whole scenario is happening here, and it's affecting the liver as well. It plays an important role, and that's what we're going to talk about today. So the advanced disease or stage of the disease of MASLD is called MASH. And MASH is what it used to be NASH, and what it's referring to is non-alcoholic steatohepatitis. And that is when you start having inflammation in your liver. So MASLD, or non-alcoholic fatty liver disease, you don't have inflammation per se. But once you start developing hepatitis or inflammation in your liver, that's called MASH or NASH, as it used to be known as. So a little bit of statistics. This or fatty liver is one of the most common liver diseases. It is the second most common reason for liver transplant. Okay? It is the leading cause of liver transplant in people under 50 years of age. So it can be said that this disease affects a generally younger population. It's not as common in higher 65 and older population. It's usually younger. It says that it has a higher prevalence in males. Its incidence, note this, is gradually increasing, especially in the younger people. That's very important. Because let's say a young person, 15, 16, 17 years old, has started to develop fatty liver. What are the results going to be when the person is 30, 40, 50 years old? Imagine those consequences, right? If they don't fix, if they don't revert, if they don't take into consideration the lifestyle changes they need to take to revert this disease. So it is increasing. There was a meta-analysis of 63 studies done, which included over 1 million people. And they found that the incidence of MASLD increased from approximately 20 cases per 1,000 person in years in the year 2000 to 70 cases per 1,000 person years in the year 2015. So this study is to note that the incidence of this disease is increasing. Most people with NASLD or NAFLD or fatty liver have normal liver disease, liver enzymes. So that's another important point right there, that you may have good normal labs, but you have already started to develop liver disease. Remember that the liver enzymes increase when you start having damage to hepatocytes or you start having inflammation, right? So just because you have normal liver enzymes doesn't mean you don't have fatty liver. Very well. The prevalence of MASLD and MASH in obesity. So it is said that more than 70% of patients with obesity have MASLD or fatty liver disease. And 25 to 30% of patients with obesity may have hepatitis or the inflammatory state of this disease. And if you see in the very bottom, maybe you can't see it up there, back there, but it says it is predicted that 51% of adults in the US are predicted to be obese by the year 2030. 51% of our population is going to be obese. So think about that. Let it hit home, okay? Prevalence of MASLD by ethnicity. Studies have shown that Hispanics in United States, 58% of Hispanics have fatty liver. 58%. Let that sink in. Almost 60% of Hispanics in the US have fatty liver disease. Caucasians, it's 45%, and African Americans, 35%. I did not find any statistics on Asians, I'm sorry. So risk factors. Risk factors, the two most common ones is obesity, one. We already talked about obesity, and we're going to talk about obesity a little bit more here in a minute. And diabetes are the main risk factors. We also have dyslipidemia, or high levels of cholesterol, triglycerides. Triglyceride levels usually, abnormal triglyceride levels are considered to be over 150 milligrams per deciliter. And HDL cholesterol being less than 40 milligrams per deciliter. So if you see your labs, you get your lab results from your doctor, and you see that your triglycerides are above 150, that's not normal. The higher, the worse. Usually patients are started on medications to lower triglycerides, now that we're talking about triglycerides, above a level of about 300. Because above 300, that's when you start having increased risk for pancreatitis and also heart attacks, right? So hypertension also, any blood pressure above 130/80, that's also a risk factor. So if you have 1, 2, or even more of these risk factors, that means your risk for fatty liver disease is very high, right? Very high. So other conditions. There are other conditions that are associated with fatty liver disease that are not directly associated with obesity. And those diseases are polycystic ovarian syndrome, obstructive sleep apnea, chronic kidney disease, and history of cholecystectomy. So if you've had cholecystectomy, you're at an increased risk of fatty liver disease. If you have obstructive sleep apnea, you are at an increased risk for fatty liver disease. That is independent of obesity, because things like obstructive sleep apnea are very related to obesity, right? But independently, they are at increased risk of fatty liver disease as well, okay? Next slide. We have a beautiful image right here of what fatty liver actually looks like. Obviously, the red, beefy one right here is normal, right? And the yellow one over here is abnormal. It's fatty. It's just full of fat. And I put the image right here of this man with a large central waist, large width, because a lot of people, actually doctors, believe that fatty liver, obesity is a spillover of a fatty liver. You understand that? So when you're having increased waist width, circumference, it's just a sign that your liver is already being affected by fat, and it's a spillover. And we'll talk about a little bit about the biochemistry of this in just a minute. So this image already says a lot. One of the risk factors we said for NAFLD or fatty liver is what? Obesity, right? And you see it right there. Right here, we see an example of the process of how this disease develops, right? So in our hepatocytes, right here, you have the normal cells of your liver. And they normally have little droplets of cholesterol in there, or fat in the cell. But as you start consuming more and more high caloric diet, high saturated fats, high carb fats, the body starts to produce more and more fat. And the fat is then stored in those hepatocytes in that cell. And what happens is that the fat becomes so big, the droplets become so big, that they start to displace the normal organelles in the cell, like the nucleus and the mitochondria. It starts to displace them, starts saying like, hey, get out of the way, I need room here. It starts to get messy in there, right? After a while, once the disease progresses, and it progresses to NASH, where we see inflammation, basically in the histologic level, what we see is a disarray of the organelles inside the cell. So they start dying off. The organelles start to function. They start to release their inflammatory cytokines and all that stuff. So what happens as well is that collagen fibers start to replace the dead cells. And that's where we start seeing a thickening or a hardening of the liver, as we see in NASH. As we see in cirrhosis. And then cirrhosis, that fibrosis becomes even more and more abundant. You start having scarring and just a remnant of dead cells. I want you to know on the top right here, once you start developing NAFLD or fatty liver, the condition is what? Reversible, right? It's reversible. That's very important to know. You start developing NASH, and it's still what? It's still reversible. It's still reversible, even if you have inflammation. But then you come to a point where you develop cirrhosis, when you have so much collagen and scarring and dead cells that the condition becomes what? Irreversible. There's no way to go back, okay? And that has also spiritual implications. We'll talk about that later. But that's important to know. Memorize that. If you were diagnosed with fatty liver, know that there is time. There's a chance for you to go back to revert, okay? If you have developed hepatitis, if you have inflammation of your liver, no, there is hope. You still can go back and revert it to a nice and healthy, beefy liver, okay? That can function normal. So that is important in this slide, okay? This next slide, just a little bit more details in regards to fatty liver disease and its development. So I want you to start considering right here, fatty liver, 12 to 40% of patients will progress into NASH. And of those patients, 15 to 25% will progress to cirrhosis. And of those patients, 7% will progress to hepatocellular carcinoma, cancer, okay? That is very important. So steatosis right here, more than 5% of fat in the hepatocytes. Here in NASH, or MASH now called, we have Yes, we have the fatty liver, the steatosis, but we also have inflammation. We have the ballooning of the cell. It's becoming too crowded in there. And then we start to see fibrosis, the collagen fibers coming in there to do their work, right? And then in the late stages of fibrosis, that's when we're going to definitely need liver transplant, or else the patient will die, okay? So this is from here and onward, that's where the condition is irreversible, okay? Very well. There you go. Okay, so very, very telling picture right here. I was actually going to bring some products, and I was going to have you guess which products have high fructose corn syrup, but I was not able to bring those products. But I have a good picture right here of just the typical products that we see in a day-to-day household in the United States that contain high fructose corn syrup. And we're going to talk a little bit about that because high fructose corn syrup has a very, very, very intimate relationship with fatty liver. Very intimate relationship with fatty liver. It is one of the, I would say, the highest risk for developing fatty liver. They did this study where they got these rats or mice, and these mice, they gave one just normal sugar, table sugar. They gave another one just high fructose corn syrup to eat, day in and day out, right? And after some time, they opened each of the rats. The one that just ate sugar had some minimal amounts of fatty liver, and then they opened the mice where they gave it a lot of high fructose corn syrup, and lo and behold, the little mice had a huge liver, but it wasn't only huge, but it was full of fat, So high fructose corn syrup causes or predisposes for you to have fatty liver. And a little bit, we'll talk a little bit more about why that is the case. But you see some of the products here. Maybe some of these products we have in the home, you'd be surprised that even medications can have high fructose corn syrup. You give medications or even vitamins to your kids, and they put high fructose corn syrup in them. So be aware of that. Ketchup, I didn't know about ketchup, but ketchup has high fructose corn syrup, okay? As well as vinegar and other things that I'm not going to go there. But soda. Do Americans love soda? Boy, they do love soda. I was telling Dr. Schaffenberg that where I studied medicine, my in-laws are here. They actually work there in the university. In the northern part of Mexico, it's actually considered one of the regions with the highest consumption of Coca-Cola. Actually, there was a year where it was number one in the whole world. And believe me, there's a lot of obesity there. It's a big public health issue there. There are towns where it's cheaper to buy Coca-Cola than to buy water. There are towns, there's actually a good documentary where it shows how there are towns they're running out of water, and the cause is because the Coca-Cola company outside of town is sucking all the water. It's incredible, and people love it. They're just hooked to it. They put it in their altars. They put it everywhere. They give it to in the Day of the Dead. You see a lot of Coca-Cola in the cemetery. So if you're thirsty, you might as well go to the cemetery, right? So predisposing factors, high calorie intake, a sedentary behavior, right? And saturated fats, okay? This is all abundant here in the United States, unfortunately. We can talk about also this little guy over here, the artificial sweeteners. Artificial sweeteners. We can open a Pandora box with just artificial sweeteners. But artificial sweeteners have been found to be a important factor for fatty liver disease as well. Maybe you've been in tune with the news and have heard about the artificial sweetener xylitol. Have you guys heard this news? It's used everywhere in sodas, everywhere, gum, that now they have found that it destabilizes the platelets, causing them to clump up together, and it increases the risk of heart disease or stroke and a heart attack and death. New study that just came out. It was on all the news. So artificial sweeteners, no bueno, no good. And I can say a lot about the fast foods and all that stuff as well, but we won't get in there too much. So glucose versus fructose metabolism. What is the whole issue with this stuff? The whole issue, I'm not going to go into a whole biochemistry class, even though biochemistry is incredible, but just to simplify things, glucose mainly converts to glycogen. And glycogen is the molecule that the muscles use readily to convert it to energy, right? Let's say we fasted. You know, we're talking about intermittent fasting right now. Let's say last night we ate our last meal. We didn't eat anything here at noon, and I'm still up here. I'm still speaking. I have energy. My brain is functioning well. How is the body doing that? You know? It's glycogen that's usually stored there, but also it starts using fats. And we're going to talk about that too in just a bit. But glucose, although it can be transformed into fats, mainly converts in the liver to glycogen to be used readily for energy. They say that we have a large store of energy in our liver, okay? That's why a lot of people that you see out there, they actually eat the liver of the animal because they believe it's going to, you know, replenish iron, it's going to give them energy, it's going to make them stronger, right? I don't know if you've heard it in some of these cultures. Fructose, the difference with fructose is that it mainly contributes to fatty acid production. That's the issue. That's why high fructose corn syrup is so bad, because it mainly shunts towards the pathway to produce more fats in your liver, in your body. And the other issue is that it also produces or generates uric acid. And uric acid is highly, highly inflammatory. Highly inflammatory. I don't want you to confuse you very much here. Just to explain what we just said, fructose right here, through this enzymatic pathways, produces uric acid, which uric acid we said is inflammatory, but it also shunts and it provides and it produces fatty acids. While glucose, although it does produce fatty acids, it produces mainly glycogen, okay? Glycogen right there. And important about this image right here is that there's a pathway called the polyol pathway. The polyol pathway is a pathway that takes glucose and converts it back to fructose. And that pathway activates when we're eating too much sugar, too much glucose, too much simple sugar, even though we're not eating fructose, just glucose. And when we're having too much, then the body says, you know, it's too much. We need to convert we need to do something with this. So what it does, the polyol pathway activates, it goes to sorbitol, and it starts to produce fructose, which fructose produces more inflammation and produces more fats, right? And that's how you start developing fat in your body, in your liver as well, okay? Next image kind of says the same thing right here. Just to reiterate, we're going to start over here, the small intestine. You eat a high fructose corn syrup meal, right? Usually the small bowel can clear out some of the fructose, but when it's too much, it causes what this term called gut microbiome dysbiosis. And what it means is that it just creates a mess in there. It creates a mess. It starts to produce a lot of inflammatory markers. There starts to be bacterial overgrowth, and endotoxin cytokines start to go up. So what happens is that it directly causes what? Inflammation, right? Inflammation. But we also see that fructose ingestion, right here we see the same thing. It's a whole pathway to uric acid. It produces oxidative stress. When you have oxidative stress, what can happen to you? You start having damage of your cells, of your tissues, and cancer starts to go up. Risk of cancer goes up, right? So that's why at the end of the pathway of the disease, of its normal progression, you see hepatocellular cancer. So oxidative stress is caused also by abundance of fructose. That's why they say if you have a normal, well-functioning liver, you are basically putting a great barrier against cancer, right? So the other thing that happens with fructose is this word right here, insulin resistance, okay? Insulin resistance. Where do we hear insulin resistance? What other disease? Diabetes. Very good. Diabetes, right? So that's why they changed the term, the name of this disease to metabolic, to the metabolic condition that now they say that plays such a big role in this disease, right? Because it causes also insulin resistance. It causes oxidation. So when insulin resistance goes up, what happens with sugar? Sugar goes even higher, right? And sugar goes even higher. What happens when sugar goes so high? fructose starts being, produced, polio pathway starts being activated, and what starts to go up? Adipose tissue. More fat cells, more fat, more fat. And what happens when you have a lot of adipose tissue? You have more insulin resistance. So you have this whole, negative cycle, right? That it's just getting worse and worse and worse. So we have to cut, in one of these places we have to cut the whole cycle that is causing disease. And it all starts, well, I won't give it away. We'll talk about it right now. In case you're falling asleep, you can stay awake. Right here we see how the increased amount of sugar consumption and obesity, which is the orange line, yellowish line is the increased consumption of sugar, also increases the blue line, which is fatty liver disease, okay? And this is from 1988 to 2012. Very good. A little bit more about obesity. So obesity, waist circumference, and BMI have a positive correlation with fatty liver. So the bigger your waist circumference is, the correlation or the risk of having a more advanced disease is higher, okay? So the bigger, the worst, okay? The higher the BMI, the worst. So a normal or abnormal BMI is any BMI above 25. That would be going into overweight. And then over 30 would be going into obesity. Higher than 35 is just severe obesity, okay? And what is the normal or healthy waist size? The normal waist size in the United States is 35 inches or less for women and 40 inches or less for men. So anything higher than this is abnormal, okay? Do you guys know what the average weight in men was in 1970s? This is very interesting. 1970s, okay, 150. Anyone go more, less? 130, 130. That's like the Great Depression right there. 170, yeah, you hear Roger. Roger got it, 170. Yes, around 170s in 1970s. Anyone want to guess what the average is right now for men? 210, close. 250, that's quite a bit. This is average, remember. This is, half is higher, than a little bit higher than that, half is lower than that, so average. 225, all right, I'll give it to you. 197, so around 200. So 200. So we've gone from 170 to about 200, okay? So that's quite a bit because, like I said, half of that population is well over 200, right? So what it is to say is that we are getting heavier. Interestingly enough, we're also getting taller. Studies show that we're getting taller. I think it's the abundance of calories of nutrition that we have. So today, shy of 200 pounds, and the average waist circumference for men is 40.2 inches, okay? How does this disease present? The most common way of presentation is in asymptomatic patients. So how do you know he has fatty liver? Well, you start seeing liver enzymes creep up. You do an ultrasound and you find that the ultrasound shows fatty liver. But most of the patients are like, hey, doc, I'm feeling well. I feel great. That is the most common presentation. You may be feeling well, but it doesn't mean that you're well. Okay, it doesn't mean that you're good, you're healthy. But other presentations, and this is actually getting less frequent. We see these less frequent as we go down. Fatigue is one of the main ones. Malaise is just not feeling very well. Like when you're sick, you're just feeling bad. Vague right upper quadrant pain. Remember, the liver is here in the right upper quadrant. So that's where you're going to start feeling like this discomfort or pain, and that's where you're going to see it, okay? If you start, the doctor may do a physical, and you might find that your liver is increased in size. So this is actually a sign, not a symptom, but it's hepatomegaly. Your liver starts to increase in size. And rarely do you see patients with decompensated cirrhosis. I do have an uncle that just recently went to see his friends in Mexico, went to actually Montemorelos. and never drank alcohol. He's SDA. And while he was over there, he started to throw up just blood. And it was abundant. It was abundant. He had to go to the ER. Went to the ER, they noticed that he had esophageal varices. And this is a typical finding in patients with what? Cirrhosis, right? Cirrhosis. So when you have cirrhosis, there's starting to be portal hypertension. The varices in your esophagus get big and swollen. The veins in your esophagus get big and swollen, and they start to bleed. And it can be very deadly. He didn't know he had cirrhosis. And what caused the cirrhosis was the fatty liver. Most of his life, he was asymptomatic. He didn't feel anything. But then it manifested with a decompensated cirrhosis. I want to tell you that this is rare. It doesn't happen very often, but it can happen. It's a presentation that is possible. So, next. What are we going to find when we do labs? Well, the first thing we're going to want to look at is your AST and ALT. AST and ALT are hepatic or liver enzymes. Just as your heart has enzymes that go up when you have a heart attack, when you have an inflammation, you have ischemia, also when your hepatocytes, when your liver cells are starting to go through some stress, through inflammation, then the liver enzymes start to go up, okay? Liver enzymes are actually the normal values for AST. It varies with labs, but AST is usually anything less than 35, 40, around there. But in women, it's less than that. Okay, so normal value for women may be like less than 30. But anything for like, let's say a woman gets her lab and it's 35. For men, it's normal. But for a woman, it's abnormal. It's too high. So AST and ALT are the enzymes that we look at to see if there's any inflammation going on, any liver damage. Alkaline phosphatase, ALP, this is actually produced in two places. It's produced in the liver, and it's also produced in the bones. But when your liver is having some damage, you're going to see an injury. You're going to see an increase on the alkaline phosphatase, and it's usually elevated by 2 to 3 times the upper limit of normal. So other things that you may see elevated in the advanced stages of the disease would be the albumin. This is proteins because the liver plays an important role in the metabolism of proteins. The bilirubin, the liver actually produces bilirubin, so that's also going to start to be affected. And finally, ferritin. Ferritin concentration and transferrin, this is iron storage levels, will also be affected, and they would be greater than 1.5 times the upper limit of normal in patients with fatty liver. So these are basically the main labs that we see for fatty liver to further assess. When do we suspect fatty liver? Well, we suspect it when, a lot of our patients, we send them out for an imaging for some other reason, and all of a sudden we find what is called an incidental finding of fatty liver. Usually that's when we start suspecting, we start seeing what's called echogenicity in the ultrasound, and the radiologist may say we have a focal echogenicity of the liver, and you start saying, most likely this is fatty liver. That's when you start suspecting it, okay? When you start having unexplained rise of levels of liver enzymes, when you start having 2 or more metabolic risk factors, there we go back to the metabolic risk factors, okay, which are obesity, dyslipidemia, prediabetes, or type 2 diabetes, and hypertension. I want you guys to just put it store it in your memory, okay? Obesity, high cholesterol, you could call it that way, high cholesterol, diabetes, and hypertension, those 4, okay? Remember that. And also, when you find a patient, you start going through their family history, and you find that their first-degree relative has fatty liver, and it's been advanced. It's been at cirrhosis stages. When patients come into the clinic and we suspect fatty liver, we also do a complete history and physical. In the physical, we want to see if there's any hepatomegaly. We start to palpate around to see if the liver is increased in size. We start to see if there's any stigmata of cirrhosis if the disease is advanced, right? But we also go and look back into their medications. There are medications that predispose the patient to have fatty liver disease. And these medications are steroids like glucocorticoids, and this is long-term use of steroids. I know a lot of patients go to the ER, they get steroids, a shot of steroids. It's not the short-term, it's the long-term use of steroids. Amiodarone, which is an antiarrhythmic medication for the heart. Methotrexate, which is a medication for rheumatoid conditions, and tamoxifen, which is a medication for breast cancer. These 4 medications have been associated with higher risk of liver steatosis, okay? And we also do further lab assessment to evaluate if there are any other causes of elevated liver enzymes and echogenicity. We check for hepatitis B, hepatitis C. We do a whole iron panel to see if there's any hemochromatosis. We see, things like anti-mitochondrial antibodies, ceruloplasmin, to see if there's like any of these exotic diseases, right? But we rule out these conditions before we go in and confirm it's fatty liver, okay? Diagnostic imaging. Basically, the diagnosis of fatty liver, sorry, I moved up here and I didn't move up there. The diagnosis of fatty liver is typically established on the basis of imaging demonstrating liver steatosis or fat in the liver. In the absence of other primary causes, like drug-induced liver injury or alcohol consumption, which also causes injury to the liver. And this is in patients with at least 1 metabolic risk factor. So we see the imaging, it demonstrates steatosis, and the patient has 1 metabolic risk factor, and then we can establish the diagnosis of fatty liver, whether the patient has obesity, hypertension, diabetes, or high cholesterol. And in the ultrasound, what we start seeing, if you get your ultrasound back, your doctor sends you your results, you're going to start seeing in the description, it says a focal point, or it says there is echogenicity throughout the liver, or there's a focal point of echogenicity in the liver. Echogenicity just means that when they see the ultrasound, it just brights up. You can see it in the ultrasound. It looks like a brightening, a glow in the liver. And they also compare it to the spleen, and basically the way they see fat in the liver with the spleen compared to the spleen is that they see the spleen more attenuated. You don't see it as pronounced as the liver, which is on the lower right-hand side. So ultrasound is basically one of the bases for diagnosing fatty liver disease. And I want you to know that we have other modalities for staging. This is for staging. We have serum or blood biomarkers, and we have imaging biomarkers, okay? In the imaging, we already spoke about transient elastography, shear wave elastography, FAST score, acoustic radiation force impulse. These are all ultrasound-based biomarkers, okay? And let's say like the one that I use the most is transient elastography. That comes back with a fibrosis score. And the fibrosis score goes from F0 to F4. F0 to F1, it says very mild fibrosis. What we want to see in fatty liver is how much fibrosis there is. It has the disease advanced. And F4 is the highest amount of fibrosis. It means the patient has cirrhosis. So any F4 in your transient elastography means that the patient has cirrhosis or very advanced disease. We have blood biomarkers, and some of these, like the fibrosis 4 index score, the APRI score, the L score, HEPA score, these basically are like, they use a calculator basically where they put your age, your sex, they put your liver enzymes, your cholesterol, your triglycerides, and it brings out a score. And it shows you what your risk of having fibrosis is. And it's actually pretty good. I see a lot of providers using the FibroSure as well, which uses 6 biomarkers produced in your liver. And it also gives you how much fibrosis there may be in the liver. So know this, that to stage, we can use blood biomarkers and imaging, and the preferred one is ultrasound. Okay, the transient elastography. Elastography just wants to know how fibrotic the liver is, how rigid it is. Biopsy. What does biopsy play in what role does biopsy play in fatty liver disease? So we do clinical labs and imaging findings, and if these basically come back uncertain, you're not very sure if it's still fatty liver disease or if there's MASH, then you can do a biopsy. So that's where it says right here, typically reserved for suspected fatty liver if uncertainty remains. But biopsy basically is the most accurate method for MASH to see if there's inflammation. There's no other way to see if there's inflammation in the liver unless you go in and histologically see how the cells are doing. What do you find there, and that's where biopsy comes in. So the use of liver biopsy for grading inflammation and staging patients with MASLD is limited by the risk of biopsy-related adverse events. So the doctor has to take into account, does this patient really need a biopsy, Because there's inherent risk with the biopsy. There could be, like it says right there, bleeding. And in the United States, they see a lot, the last one, cost, right? So those are considerations that the doctor takes when thinking about doing a biopsy, which I don't see very often done nowadays with our imaging modalities and all that stuff, all the biomarkers for staging. Screening. What are the recommendations or the guidelines for screening? Sorry about that. There you go, screening. So the American Association for Study of Liver Disease, that's the AASLD, does not recommend any screening, even for high-risk groups, okay? No screening. But our European buddies over on the other side, they say that screening is recommended with patients with obesity and metabolic syndrome, and you have to screen with liver enzymes and/or an ultrasound. The National Institute of Health and Clinical Excellence, the NICE, has no recommendations also for screening, okay? Treatment. Here we get to one of the most important parts of fatty liver disease. In the United States, we've been taught to look for things that are very quick in solving our problems, right? If we feel hungry, we just want fast food, right? Just the quickest thing to solve that issue of hunger, right? And in medicine, we've also been taught, hey, what is the medication that I need for this condition? All right, I have fatty liver disease. Now tell me the medication. Just fast forward, doc. Just go to the medication, pharmacotherapy. But in this case, in particular, in fatty liver disease, there's a spoiler alert. There's no medications. There's no medications, okay? But the treatment is powerful. It's powerful. And all you know it. There you go. It hits at the foundation of the problem of metabolic syndrome as well. If you have hypertension, you might have hypertension, but you don't have fatty liver. You may have obesity, your waist circumference is enlarged, but you don't have fatty liver or hypertension or diabetes. But with lifestyle modification, with the health message that we've been given, you hit at the core of the issue. And that's what I want to just engrave in your mind, right? That God has given us a powerful message, a powerful treatment modality. It's so simple that even children can do it, right? But at the same time, it's so hard. It's so hard. Sometimes it brings me to tears to see, some of my beloved patients struggling so much. And you'd think it's cocaine, it's fentanyl, it's all these other conditions. Yeah, that's a big issue. But sometimes it's the soda, doc, the soda. I can't let go of the soda. It's just, doc, you have to go walk. It's so horrible. How am I going to go walk in this 105-degree weather, And to tell you the truth, it's hard even for me. It hits at the core of all of us. Doesn't matter where we are. Doesn't matter if you have a perfect liver. We all still have to do our lifestyle health modifications, right? We all sometimes slip too. And we all have to modify it and go and adjust it and improve it, right? So that's where the core of the solution for fatty liver lies. A calorie intake reduction of 30% or a reduction of 750 to 1,000 kilocalories per day improves two things: insulin resistance and fatty liver, okay? The limitation or the reduction of fructose-enriched food that we already spoke about also helps. long-term maintenance approach. They say this a lot in the studies. They do studies and they see patients do these changes, but it's so short-term that they can't see the benefits of it. So they're most of the studies that I was reading, they all say make sure they maintain the approach or the change, the lifestyle modification that they took upon themselves. Make sure they are consistent. Consistency is the key. That's the key. A low-carb diet or a ketogenic diet, we're talking that with Dr. Schaffenberg right now. How important, some studies show that ketogenic diets are very good. And ketogenic diet is very important in this case because obviously the high amounts of carbs are a direct producer of the fatty liver. So dietary strategies. What dietary strategies can we do? So right here we go back to the same thing, the macronutrient manipulation. We do high protein and we bring down the amount of carbs, especially, and I'm not demonizing carbs or talking bad about carbs. Trust me, I love carbs. But when you're going to eat carbs, it's high-quality carbs, not the highly refined carbs with the additives of high fructose corn syrup. You saw the French fries over there. Those are the highly refined carbs and with a lot of saturated fat. And McDonald's also puts an additive, and that's high fructose corn syrup. So imagine that double whammy, triple whammy right there, right? So you're having very bad carbs along with high fructose corn syrup in a lot of our diets. So it's bringing down that amount of low carbs, the unhealthy carbs, and increasing the amount of proteins. And you have abundance of proteins. A lot of people are like, what am I going to eat if I don't eat meat, right? And I just think, wow, if just Medicare would pay me just to give a lecture right here, right? An hour lecture, but they don't. So it's very important to increase the high protein while we bring down the carbs. Timing manipulation, so that's coming back into intermittent fasting, right? The importance of intermittent fasting. And there's a lot of ways of doing intermittent fasting. I'm not going to get too much into it. But not only intermittent fasting, but also longer-term fastings are also beneficial for fatty liver disease. We go down to the Mediterranean diet. Studies have shown that the Mediterranean diet, they did a 6-month observational study with monthly nutritional counseling in patients with fatty liver, and the results showed that the frequency of grade higher than 2 steatosis or fatty liver decreased in 8% with resolution in 20% of the patients just with the Mediterranean diet. But as you know, the Mediterranean diet, they use a lot of olive oil. And I was seeing a study about olive oil, and I know there's other controversies, cardiovascular controversy in regards to that. But I've seen that olive oil plays an important role in decreasing fatty liver as well. As we know, they did a study, the DASH diet. The DASH diet is a diet that we recommend for hypertensives, people that have high blood pressure. And it's basically composes of vegetable, fruits, low fat with moderate amount of whole grains, fish, and poultry. And this correlated with lower amounts of fatty liver prevalence. So the DASH diet that was just thought to be beneficial for hypertensives was noted to be beneficial for fatty liver. These are some studies that I found. Although you see you see what the DASH diet composes of and the Mediterranean diet, of course it's going to be beneficial. It's a lot of vegetables and fruits and just good fats, like avocados and all these other things, right? But the diet that I recommend the most is this one, right? It's a simple plant-based diet. And plant-based diet lowers the risk of fatty liver, of course, and this is regardless of genetic susceptibility. But there is also unhealthful plant-based diets, and this was associated with a higher fatty liver disease. I believe this happens, a lot in our maybe our Adventist culture. We know a lot about good healthy diets with plant-based diets, but many times we resort to things that are unhealthy, even in the plant-based diet, right? And that's very important, okay? Just because we are eating plant-based diet, I can just, tell everyone, hey, I'm plant-based diet. Doesn't mean that I'm healthy, right? And you see it here in this correlation that they did on this study in particular. You see overall plant-based diet and the index of fatty liver came down. I think I see a more pronounced decrease here on healthful plant-based diets. And this one that increases right here in the bottom, for those of you that are in the back, this is the unhealthful plant-based diet index and an increase in fatty liver, okay? So just because you're plant-based diet doesn't mean that you're healthy. But if you do the healthy plant-based diet, the prevalence of fatty liver drastically goes down, okay? Weight loss. 3 to 5% of weight loss can improve steatosis, but 6% to 10% is needed to improve hepatitis or inflammation and fibrosis. This is one of those cases that, the more the better, as long as it's in the healthy range. But obviously, if your liver is not producing too much, it's not having too much calorie intake, it's not having a burden of calories, it's not having to produce more fat. In the contrary, you're burning that. Obviously, the fat in the liver is just going to come down and down until the liver starts to function normally again. The liver is going to start using those large molecules of fat that are in the cell. It's going to start consuming it as source of energy, and that's going to basically clear out the liver. There you go. NAFLD treatment with weight loss. NAFLD treatment with weight loss. So you see right here how much weight loss the patients had. This is 52 weeks of lifestyle intervention. 5% weight loss, 7% weight loss, 10% weight loss. How many patients had resolution with 10% weight loss reduction? 90%. You see that? 90%. So the patients that had weight loss of 10%, the NASH, or the inflammatory state of fatty liver, was decreased by 90%. And so it goes down. This is a very good graph. Fibrosis regression right here. How much? And those that reduced their weight by 10%, 81% came down. Steatosis improvement. In those that decreased 10% of their weight, 100% resolution or improvement of the fatty liver. You see that? Just 5%, you see right there? Just 5%, 65% right there of steatosis improvement. And you see the patients that achieved their weight loss, and there you see it in the very bottom. So the higher the weight loss, the better for you. The better fibrosis is going to come down, inflammation is going to come down, and fat in the liver is going to come down. Exercise. It was found that exercise alone may reduce steatosis, and improvements are seen in liver tests, liver histology in the biopsies, serum insulin levels, and quality of life in patients. A study from National Health and Nutrition Examination survey showed that exercise was associated with lower risk of all-cause mortality during an average follow-up of nearly 11 years. It is recommended that patients enroll in a weight loss and exercise program, which saw the greater weight loss in 1 year. And what's recommended, according to this study that we found here from the National Health and Nutritional Examination Survey, says that moderate intensity exercise of 3 to 5 sessions a week and resistance training is promoted not only to improve your musculoskeletal fitness, but also improve your metabolic factors that are contributing to fatty liver. Obviously, as you go in and you do more exercise, you're getting more oxygen intake. The liver will appreciate that and will function better, right? No alcohol. I'm not going to spend a lot of time there, but it's a given. Don't injure your liver more than it already is. So no alcohol. And I'll be straightforward with you. A lot of studies say that just the moderate consumption or a healthy intake of alcohol is not a problem. But I do not believe that. I do not believe that. I believe that no alcohol. Why are you going to give something to your body that actually cannot tolerate at all? It's not normal for you. That liver, just struggles to metabolize. Why are you going to give something like that? Don't give alcohol. Don't damage it more than it already is, and it will regenerate itself. Pharmacology. I said that there's no one medication proven to help with liver disease, but some studies recommend vitamin E. Vitamin E. Okay. Sorry, but there you go. Vitamin E. Vitamin E at a dose of 800 international units a day is beneficial only in patients that are non-diabetic or non-cirrhotic and that have inflammation already in their liver, okay? Patients that have a high risk of prostate cancer or have a family history that is strong for prostate cancer, vitamin E is not recommended, okay? No intake of vitamin E is recommended for high risk for prostate cancer. There are some other medications like resmetirom that is being studied right now to see they're very hopeful. They're very excited that it might help, fatty liver disease. But if I'm honest with you, I highly doubt it because lifestyle is the basis of it, right? Ways to heal your liver, okay? This is one, fasting. We already talked about intermittent fasting, but I want to talk a little bit more about fasting in the aspect of what's called autophagy, or I can't say the name, pronounce the name, autophagy, there you go. That is the process that allows your body to break down and reuse old cells or parts of your cells so that your body can operate more efficiently. It uses what's called the lysosomes in your cell membrane, in your cells. You have lysosomes, and these lysosomes work as recycling centers. They take debris, defective proteins, and they recycle it. The body recycles it through the lysosomes. And this is a natural cleaning out process that begins when your cells are stressed, or it can happen in extreme cases when they're deprived of nutrients, right? And autophagy is actually activated when you're fasting, okay? It's activated. That's when it starts. The body starts this cleaning out process in your body in a way to protect it. So that's good for your liver. Researchers are studying autophagy's role in potentially preventing and fighting disease. Exercise, intermittent fasting, and prolonged fasting, curcumin, ketogenic diet, heat and cold therapy, sleep, leafy greens, calorie restriction, all these things increase and activate autophagy. We have lemon water. Lemon water is a great liver tonic solution or product, right, that God has created. So it's simple as that, just lemon water. Put some lemon in your water in the morning, and that's very good for your liver. And I could talk about all the benefits of lemon water, but it would take a lot of our time. We have to trigger our phase 1 and phase 2 detoxification. So the liver, as we all now know, detoxifies a lot of our things that come into our body. Not only things that are into our body, but when harmful substances come into our body, the body actually stores it, encapsulates it, you can say, in our fat cells, right? So when we start breaking down these fat cells, what starts to be liberated is what? These toxins that are bad for us. So patients that were in the army in Vietnam, they worked with a lot of chemicals. When you start to have them fast, you start seeing a deterioration in their health. And the reason why is because all these toxins that were in their fat cells, they start breaking off. The body's now using these fat cells, and here you go, all these toxins out there, all these free radicals, right? So what we need to do when free radicals go up, a lot of our institutions that do lifestyle, they do juicing while they're fasting, right? They do juicing to provide powerful antioxidants to counteract these harmful toxins. Not only that, but this also helps to bind the toxin and make it hydrosoluble so that it can be excreted through our bile and through our kidneys, through our urine, okay? So that's one of the things we need to do. And one of the things that actually helps with this detoxification is basically, I have it right here, there's certain foods that help a lot, and one of those is broccoli sprouts. Broccoli sprouts have a lot of sulfur component to it. And these sulfurated components in our liver are used to create some amino acids that actually are very beneficial to our liver and actually help the healing process of our liver. So if you want to take something, take broccoli sprouts. They're very good for your liver, okay? Another thing that we can also use is these tocopherols. Tocopherols also comes from the tocopherol family. Tocopherol family, or the tocopherols, are the vitamin E's. So tocopherols are actually a group of compounds belonging to the vitamin E family and protect also against oxidative stress. Milk thistle, for many times, or they have a lot of names for this milk thistle. It's a weed that is thought also to have protective mechanisms or components or properties for the liver. It's also used when patients are using medications like statins and other medications that cause damage to the liver. They give milk thistle as a protective mechanism. I went into the studies and see what they say. They're still back and forth. There's still no clear study that they show that it's super beneficial. But it happens a lot with these natural remedies, right? Also garlic, turmeric, and to be honest with you, there's a whole list of beneficial plants that are and things that God created that are very good to heal our liver. So as a summary, very quickly, fatty liver, I want you to know and reiterate that it is the most common liver disease, okay? It can lead to MASH, inflammation, and fibrosis, and finally, liver cancer, right? MASH, or fatty liver, is also associated with increased risk of liver complications, including liver cancer. The liver biopsy is important, but there are other non-invasive tools that are available to us, including, and most importantly, the ultrasound. Lifestyle is the cornerstone, specifically for weight loss, of treatment of fatty liver. And most important, another important point is that there are no pharmaceuticals for the treatment of fatty liver, only vitamin E. There's some studies that show that it can be helpful. I want to finish with this. What does the Spirit of Prophecy say in regards to the liver? Very quickly. Here's several quotes that I want to read to you. It says, the first one up here, it says, "It is not the aged alone who neglect exercise. Men in young years fall into the same state of physical inactivity." So there you go, we need exercise. "Some grow corpulent." Corpulent means obese, right? "Because the system is clogged." It's a way of saying that we have too much junk in our system, too much calories. "Others become thin and feeble because their vital powers are exhausted and throwing off the excess of food." And she says, "The liver is burdened in its efforts to cleanse the blood of impurities, and sickness is the result." The next paragraph says, "The principles of health reform should be brought into the life of every Christian. Men and women who disregard these principles cannot offer to God a pure, vigorous devotion, for a dyspeptic stomach or a torpid liver make the religious life an uncertainty." That's very powerful. "Eating the flesh of dead animals has an injurious effect upon spirituality. When meat is made the staple article of food, the higher faculties are overborne by the lower passions. And these things are an offense to God and are the cause of a decline in spiritual life." There you go. She's linking our health with spirituality. If we want a revival, what do we need? We need to take this serious. We need to cleanse our liver. We need to become, everyone has some corpulence going on. We need to bring down that corpulence, right? And look what it says over here in the bottom. Talking about emotions in the liver. "Sadness deadens the circulation in the blood vessels and nerves and also retards the action of the liver." Sadness. Imagine that. Your emotions play an important role. A few more, and this is talking about self-denial, the cure for disease. It says, "Satan is the originator of disease. There is a divinely appointed connection between sin and disease. Sin and disease bear to each other the relationship of cause and effect." Sister White, a lot of times in her writing, says that we need to always think in regards to health as cause and effect. What I'm doing, what's the effect going to be upon me, right? And not only health-wise, physically, but also mentally and spiritually. What is it going to affect? If I eat this, what is it going to affect, right? Disease never comes without a cause. The way is first prepared, and disease is invited by disregarding the laws of health. And in other writings, we see that the disregard of the health laws is a disregard to the laws of God in heaven, right? And lastly, it is necessary for the disciple to follow his master, and enough for the servants to be as his Lord. Our tables, listen to this, our tables are frequently spread with luxuries not helpful nor necessary, because we love these things more than we love self-denial, freedom from disease, and a sound mind. So self-denial, that's why it hits us all. Whether disease or non-disease, self-denial is the best cure for disease. To say no when someone offers something, you know? When you go to a party and everything's nice and you're disregarding all the troubles of life and even spiritual troubles, and all of a sudden they say, hey, have this Coca, this Coca-Cola, have this, burrito, it has all this cool, nice, beefy stuff. And you say, brother, thank you, but no thank you. I love you, and I do appreciate what you're offering me. Please offer me something else, like Daniel, right? Give me, some water. Give me some fruits. I'll take that watermelon that's there, right? But self-denial is the cure for disease, for a lot of things, right? In the realm of sensuality, to say no to sensuality. Why? Because the effect is going to be disease and death, right? Self-denial in all things is a blessing. And I want to finish with this. Here you go. I like this image. This image, I think it's powerful. And I want you, maybe don't think about the bottle of alcohol right here. Maybe put your item right here, right? What item are you struggling with? What item is causing your liver to be affected? What is it? I don't know. You tell me. I want you to think about that. What things are affecting your liver? Did you guys know, maybe you do, that fat, we're talking about fatty liver. Fat in the Bible is a symbol of sin, right? Fat is a symbol of sin. Leviticus 4:32. I want to read what it says right here. It's talking about the sacrifice that the person was to bring before the sanctuary. And it says that the priest shall take of the blood of the sin offering with his finger and put it upon the horns of the altar of burnt offering, and shall pour out all the blood thereof at the bottom of the altar. And verse 35 of Leviticus 4 says, and he shall take away all the fat thereof. They were supposed to take all the fat from their sacrifice. It correlates with today's sermon, right? Our sacrifice needs to be without fat, without sin. Why do you think the sin of the young men, Eli's son, was so despicable to God? Why? What would they do? When the offer was there preparing, the sacrifice, they would come and they were supposed to get some of the meat with the flesh hooks, right? And the offer would say, hey, hold on, let the fat be consumed away, be burned away. But the Bible says that the young men would not wait for the fat to be consumed, but they would take it like that. And they'd say, hey, get out of here. I want this right now. And they would take the sacrifice. They would take of it with the fat in it. So the people just despised the sacrifices of God. And it was something that was really despicable to God. It was an abomination to God. I imagine when David was having envy of those that were wicked. And then he says, but I went into the sanctuary, and there I saw the end thereof of the wicked. And I think of David, after he sinned against God with the kids with Bathsheba, and he would go to the sanctuary, and he would see the people taking their sacrifices and carefully taking off the fat. And then they would get the fat and they would burn it until the fat would be converted into ashes. And there David saw the end of sin and those that had and did not want to remove sin from their lives. That was the end. They would turn into ashes. That's it. And I believe God is calling us calling us to take away all the fat from our lives. 1 John 3:3 says, and every man that hath this hope in him purifies himself, even as he is pure. 2 Corinthians 7:1 says, having therefore these promises, dearly beloved, let us cleanse ourselves. Let us take away all that fat. Let us cleanse ourselves from all filthiness of the flesh and spirit, perfecting holiness in the fear of God. James 4:8 says, draw nigh unto God, and he will draw nigh unto you. Cleanse your hands, ye sinners, and purify your, livers, ye double-minded. Satan's snares are laid for us as verily as they were laid upon Israel before they're going into Canaan. We are repeating the history of that people. We are seeing in our midst lightness, vanity, love of ease and pleasure, selfishness, impurity, and it is all increasing among us. And there is need now of men who will stand firm and fearless in declaring the whole counsel of God. Men who will not sleep as do others, but will watch and be sober. Just as fat, brothers and sisters, has a deadly effect upon the liver, causing displacement of important organelles in the cell membrane, and causing disarray and fibrosis, stiffness. In like manner, sin causes displacement of everything that is good in the human heart. It destroys spirituality, causes disarray in the human life, in the family, in the church. And finally, sin causes hardening of the heart. It causes encephalopathy. And the end result of a life of sin is a heart of stone, is a liver of stone. Hebrews 3 verse 12 says, take heed, brethren, lest any of you be hardened through the deceitfulness of sin. Sister White writes that even one wrong act or one wrong trait of character, one sinful desire persistently cherished, will eventually neutralize all the power of the gospel. Every act of transgression, brothers and sisters, everything that we see, that we hear, that is not according to God's will, hardens our heart. And speaking spiritually, there's also no way to really revert this condition. The only solution is a transplant. That's the only solution. There's no other solution for us. The only solution is a transplant. And I imagine, myself as a sinner, and I exclaimed, dear Lord, I need a donor, right? I need a donor. Where is the donor for me? When you have transplants, usually the person that will be compatible to you is a next of kin, your brother, your sisters. Spiritually speaking, the next of kin is Jesus, right? Is Jesus. And when we exclaim, dear Lord, I see myself, I see my liver is dirty. My heart is sick. It's hard. I need a transplant, Lord. And we exclaim, Lord, I need a donor. Then Jesus or God tells us, and he exclaims to us, that if the sinner returns, he may yet realize, he says to us in Job 33, verse 24, it says, deliver him from going down to the pit. I have found a transplant for him. And that transplant comes from Jesus. That's correct. It says in Hebrews, wherefore in all things it behooved him to be made like unto his brothers, that he may be a merciful and faithful liver heart transplant donor. Jesus is the donor for each one of us. Our hearts may be hardened by sin, but there is one who has given his life, who became like us, so that he could give us his heart. And it's not a partial transplant. It's not just the 25% of his heart that he's wanting to give us. He's wanting to give us his whole heart. He wants to renew our hearts and make them full in him again. A new heart also will I give you, and a new spirit will I put within you, and I will take away the stony liver or the stony heart out of your flesh, and I will give you a liver or a heart of flesh. Ezekiel 36:26. As we talk about this condition of fatty liver, I want you to go away with the message that fatty liver is reversible. It's through lifestyle. There's an effort that we need to put into it. And also, the issue with sin in our lives, in the hardening of our heart, there is also a solution. God is calling us for a revival in our midst, personally, in our families, and in our church. And that revival starts with every decision that we take every day. Each decision. Self-denial. And as we read in the first part, it is through the agency of the Spirit of God that we can get that revival. And that is my prayer today as we go out, that we may take smart decisions, faithful decisions, consistency, and that the revival that we so yearn for may become a reality in our lives. God bless.
Thank you so much, Joshua. How many of you enjoyed Dr. Arvizu's presentation today? That was excellent. Did you learn something today? Amen. Amen. So, Joshua, do you have a couple minutes for questions? All right. So, we'll take a few minutes for questions. I'll ask Dr. Arvizu's young son, who's got a lot of energy. Can you look for people who have raised hands and take this microphone for me? All right. First off, there's a lady back there.
We have two hands. We have one right here and over there. And up here, yeah.
Thank you so much. Could you explain an unhealthy plant-based diet, please?
Unhealthy plant-based diet. So refined carbs, I would just say that, just very refined carbs is something that I see plant-based diet users resort a lot to. So yes, there's not a lot of animal products, but the quality of the carbs and the proteins is very bad. It's highly processed. That's one of them. So you could be plant-based and you could be eating a lot of Impossible burgers, for an example, right? Impossible burgers are not very healthy for you, and studies are starting to come out about the health effects of these highly processed meats. So that's proteins. And I can say a lot about also the highly refined carbs that we intake. I would leave it at that. It's very broad, but highly processed, highly refined is what's unhealthy as plant-based, yes. And there's a lot of, it's not only Impossible Burger, it's also Beyond Meat, and there's a lot of other, proteins.
I wanted to ask, when you see patients with the fatty liver, the reversible type, as a Western-trained physician, what do you tell them? The reason why I'm asking this is I also see patients as a home health nurse who I know if they change their lifestyle, many of their problems would go away or reverse. Mm-hmm. But I feel bound and I feel kind of stuck because of the policies of my employer as far as stepping out of the policy in what I educate the patients to do. What has been your experience as to what do you tell your patients? You have fatty liver. Then they say, what do I do now? What do you do with these patients?
Yeah, thank God I don't have, limitations in that way. Maybe time limitation is the biggest one for us as providers. We have a busy schedule, so you don't have a lot of time to explain, right? I've resorted many times to fear, but fear doesn't cause change. Many times, they can do a short-term change in their life because of fear. You tell them, fear-mongering. You tell them, hey, you're going to get cancer, you're going to get cirrhosis, and this is, and patients get scared. Oh, doctor, I'm going to die, right? But then they come back, several months after, and they're like, oh, doctor, I'm still doing this and that. So fear is not really effective. I found that there's one effective method. Quickly, yes, educating about liver, that is reversible. It's in their power. They can do it. So it's possible. You're giving them hope, and always patients need hope. And clear instructions on what is going to help. In this case, weight loss, whether it be with exercise, and quickly explain what exercise is. In the slide it said resistance training exercises help a lot. But where I'm going is that I take the counsel of Sister White. When you pray with the patient, prayer does a lot. It does a lot. We underestimate prayer. It is our privilege, he says, to pray with our patients. When you pray with your patients, something happens. Like the patient actually, something clicks. It's like, this doctor really cares for me. You know what I mean? And I've even seen irreligious people, weep after you pray with them. After you pray with them, something happens. And I believe it's the Spirit of God that touches their hearts. It's like my children. Sometimes they're like, gosh, come on. So many times I tell them, leave this habit. There's like Caleb's like, come on. He doesn't like worship. I see him like always like messing around. He's not obeying. He's not doing his chores. But it's when you pray for your children that something happens. And that's powerful, because at the end of it all, it's not your nursing capabilities. It's not your doctor's certificate. It's what certification did Peter have? He didn't have anything. He was a fisherman, and he healed thousands of times better than I ever will ever heal. Well, I hope one day the Spirit of God may use me the same way, right? But it was the Spirit of God. All glory to God, right? So prayer, I think, is a short prayer. Even, I don't know if your employer will limit that. I hope not.
I got into trouble. The patient, so.
I'm sorry. Well, pray for your employer. Pray for your employer so he can soften their heart. That's a hard one.
Am I on? Yeah,
Yes.
yes, I am. I would like to know, I know beets are good for detoxing the liver. Is there other vegetables that we can really get ourselves involved in? Because beets, you get just the beets.
Yeah, like I said, the broccoli sprouts are very good.
Yeah, broccoli sprouts. The sprouts or the broccoli? I'm sorry.
No, the sprouts. I should have brought a picture of it. There's sprouts. They look like grass.
I've seen clover sprouts.
Yeah, they're sprouted. Yes, exactly. Those are very good because of sulfur compounds in it. Yes, beets are good too. Yes, so there's a lot of foods or vegetables that are very good for us, right, for the liver. The list was so exhaustive, but I just put some of the main ones, right? But yes.
Is there any type of medication that could acutely raise liver levels?
Acutely.
Yeah.
Well, one of the most common ones is, commonly used is Tylenol, right? Tylenol, if you use it too much, more than the dose recommended, and some patients that are susceptible will cause acute hepatitis. And that, you see the liver enzymes go very high. They will go up to 600, 1,000, over 1,000. There you see that this patient needs to go to the hospital, right? But Tylenol, I say Tylenol, and I pick on Tylenol because it's so commonly used. Who doesn't have Tylenol in their house? It's like everyone has Tylenol, right? Good job. No Tylenol. But yes, Tylenol would be one of those medications that will acutely raise. Statins will also cause liver injury, not as acutely as Tylenol, though. Okay? Yeah. Yes. So if you have kidney function issues, they'll tell you don't take the NSAIDs, take the Tylenol. But then you're killing your liver as well, right? Yeah. Don't get me started with the pharmaceuticals. There's one over there. Sorry, we'll go up to.
Is it possible to eat too much whole, fresh fruit to the point of giving yourself too much fructose or anything like that?
It'd be very hard, I was even looking into honey, pure honey. What did it say about honey? The use of honey in moderate to mild consumption of honey actually decreases the risk for fatty liver. It's very interesting because you'd say if honey has a lot of it, will increase your triglycerides, some people say, right? And they did a study where they had some patients actually consume high amounts of honey. And it says that the studies came back with no correlation with fatty liver. It's very interesting. So the things that God created, very hard. You have to be maybe like, we were talking a while ago about something else. But yeah, maybe you have to see your psychiatrist if you think you're taking too much of the good, even the good stuff, Yeah, so if you find someone, a family member, that's eating too much watermelon, excessive amounts, maybe something's wrong, But very hard to get something like that.
I know Ellen White said to eat largely of fruit, so this is good news.
Yes. And everything with moderation, even the good stuff, right? because overeating causes a state of fermentation, right? And we have very good topics that we can.
We have a condition on my mother's side of the family that's quite rare, alpha-1,
Antitryptase.
I guess.
Yes,
I don't know.
yes.
It's
That's one of the things.
cousins.
That's actually one of the things we study for, just in case that we do labs on. So just to rule out, right?
Really? Supposedly, I'm a carrier.
Yeah. So
What does that mean? I mean, I don't know about my kids or grandkids.
it will be
They do
passed.
a lot of very bad
The
dietary.
carrier gene will be passed on. Usually patients with alpha-1 antitryptase deficiency will have lung issues and liver issues. So yeah, that would be the case, especially if you're not only a carrier, but you have the 2 genes from both parents, then that will activate and will manifest the disease more clearly, right? So if you're a carrier, you might have mild forms of the disease, even nothing in some cases.
Can that cause fatty liver too?
I wouldn't say so much fatty liver. Maybe you're predisposed to it, but more fibrosis in your liver. Yes.
I see.
Yeah.
Okay. Well, thank you.
Yeah, because that enzyme affects the elasticity of your lungs and of your liver as well. So if you have deficiency of it, it will make it more stiff. Yes. Yes, I hope it doesn't manifest in your life. We'll pray for that.
I heard about a liver cleanse that you take 1 lemon, you squeeze it, and you take it with like 2 teaspoons of olive oil, and then you increase it 2 lemons the next day, same amount of olive oil, and you go up to 7, and then you decrease, and that does a liver
Like
cleanse.
a liver cleanse, yes. I saw there's so many recipes, right, to cleanse your liver, to clean it like acutely, right? And yes, lemon, like I said, is a great cleanser of your liver. And as the study said for the Mediterranean study, olive oil is also very good. So I would say, according to studies, it shows some good outcomes in fatty liver.
What's your opinion on, or if you've heard of castor oil packs for liver detox?
Oh man, yeah. My mom would know a lot about this because she uses a lot of castor oil. I haven't, honestly, I would respond in regards to studies. Studies haven't shown anything, but I have faith in castor oil. I just don't want to, seem having faith on something that there's no proof, scientific proof. But I believe castor oil works even for gallbladder stones, I've heard from patients that have had gallbladder stones, they put the castor oil for one night, the next night, it's all gone, kidney stones in that case, sorry. And happens with gallbladder stones as well. They check them again and the gallbladder stones aren't there. I believe it's the castor oil, but I can't say 100% yes, castor oil, that's it, right? I haven't seen any studies, I'm sorry.
Are you talking about castor oil poultices?
Poultices,
Yeah,
yes.
poultices.
Poultices.
Now, what about the turmeric? How do you recommend? Is it in a capsule or powder?
It comes in any way. You could use it in a capsule, but you can use it in food. My in-laws lived in India, and they use it for everything, even for the fruit. I was just so fed up with turmeric. When I left India, there's like turmeric everywhere.
Yeah.
But yes, you can use it in a daily. As daily consumption as an additive to your food. If you do tofu, you add it to your tofu, and I think that's the best way to use it. I think you digest it better that way.
Okay. And also, where do you practice, and can we make appointments?
I practice in Stellant Health. It's there in the campus of Weimar University. Stellant Health. Stellant Health. Stellant, S-T-A. Yes, it's in the Weimar University, but it's not part of the Weimar University. Unfortunately, I'm not going to be working so often there anymore. Next month, I'm going to be transitioning to the Depression Anxiety Program with Dr. Nedley, and I'll be doing a 1-year fellowship there. So I'll be coming in once or twice a month to the clinic. So if the schedule is full, I'm sorry. I do a lot of procedures there, a lot of knee injections, so they all packed in. I'll still be going, yes, once a month. Once or twice a
Talking
month.
about the cleansing of the liver, in meat ministry that I went to for the tumor treatment, we drink the half cup of olive oil with the lemon juice.
Yeah, yeah.
With the lemon juice, and then we do bolters with the castor oil. Warm it up in the stove or oven, and then put it over here where the liver at overnight.
Yeah.
So that's what we're doing in ministry.
Maybe we should do one of these studies ourselves. If there's no studies in regards to it, maybe we should do the study and start doing the lemon with the olive oil and the poultice of castor oil, and see how the liver, maybe see in some patients that have elevated liver enzymes, try it for several days, and then check the liver enzymes again, see if they come down. It would be a good study.
Yeah, one last question. Do you have a question, sir? Yeah, one last question.
I'm just wondering, do you have a pamphlet or a booklet or something? I mean, this is a lot of information.
Yeah.
And Dr. Nedley said, I have beginning stages of dementia, so I need some help.
We can print out the presentation and
Yes,
Yeah.
I like that. I can't remember all this.
Yeah, so in regards to that, we will have Dr. Arvizu's slides. We're going to post these slides as well as our last presentation on the Granite Bay Health Ministry page on the church website. They will be there. Also, you should be able to soon find his presentation on the church's YouTube page. Okay, our first presentation from June with Dr. Cruz is already up on the church YouTube page. Okay. All right. Well, thank you again, Dr. Arvizu, for sharing your time with us. Let's give him a hand. May the Lord bless you in your ministry and your service. And this is something really that the Granite Bay Health Ministry team is really our focus for this year, is to bring you evidence-based information that you can then, in turn, take and use to support our health evangelism work, right? As we go out and serve our communities, we can incorporate it first into our own lifestyles, but then use it to evangelize others and to, one, impact their lives that way, but also so their lives might be impacted by the gospel as well. All right. So let's have a word of prayer as we close today. Father God, we thank you so much for the information that we've received today, Lord, and that we see how you've created our bodies. We know that we're marvelously and wonderfully made, Lord, and you've created our bodies to run on the food and the fuel that you have created, Lord. Whole food, plant-based, is the best remedy and medication for our lives. And Lord, we know that by your grace and by your power, all of us can begin to make changes in our lives and our lifestyles, Lord, so that we might be examples to those that you would have us give witness to, of the power of your Spirit working in our lives. We ask that you would be with us today as we go about the rest of our Sabbath. Bless us as we go our ways now. We ask these things in Jesus' name. Amen. Thank you, everyone. And our next presentation will be coming up, I believe it is August 27th. It's the last Sabbath in the month of August. And Dr. Katie Cruz will be presenting part 2 of Creating a Healthy Thought Life. Thank you.